Exercise has been described as the best medicine and as a miracle drug due to the numerous health benefits it provides. So how much exercise should you perform, and what health benefits can you expect? That is what we will explore in this video. Two primary guidelines addressing how much you should exercise are the 2018 Physical Activity Guidelines for Americans and the 2020 World Health Organization, or WHO, Guidelines on Physical Activity and Sedentary Behavior. This latter guideline is largely based on the former, so they are similar. I will first review the most relevant details for the 2018 version and then show the differences in the WHO guidelines. The 2018 version recommends the following. For ages 3 to 5 years, children should be physically active throughout the day. For ages 6 to 17 years, children and adolescents should perform at least 60 minutes of moderate to vigorous physical activity daily, while including vigorous physical activity and both muscle and bone strengthening physical activity at least 3 days a week. Muscle strengthening activity includes activity against increased resistance, while bone strengthening activity includes additional exercises such as running or jumping rope that involve bodily impacts. Adults should perform 150 to 300 minutes of moderate physical activity or 75 to 150 minutes of vigorous physical activity spread throughout the week, while including at least moderate intensity muscle strengthening activity 2 or more days a week. Older adults should additionally include balance training. Almost all individuals will likely experience some health benefits from decreasing sedentary behavior. The guidelines additionally discuss considerations when pregnant or postpartum, but we will save that for another video. If this concern applies to you, then I recommend you discuss it with your OB/GYN provider. This is all fairly clear, but we need to determine what counts as moderate and vigorous physical activity. The guidelines use absolute and relative measurements to define physical activity intensity. We will start with absolute measurements, done with metabolic equivalents of task, or METs. One MET has a technical definition you can see on the screen, but we do not need to worry about any fancy math. Just realize that one MET is equivalent to your resting metabolic rate, or the amount of energy you spend just sitting at rest. If you perform a different activity that utilizes 3 times as much energy as sitting at rest, then this activity has a value of 3 METs. Moderate physical activity is defined as any activity between 3.0 and 6.0 METs, while vigorous physical activity is defined as any activity that is 6.0 METs or greater. I'm including links in the description to websites that list the MET values for hundreds of activities for both children and adults that you are welcome to go through, by including some examples on the screen so you can get a general idea of where different activities rank. For example, running 4 miles per hour, which is a 15-minute mile pace, is roughly a 6 MET activity, while mowing the lawn without a power mower is a 5 to 6 MET activity, and walking briskly is a 3 to 4 MET activity. Regarding relative measurements of exercise intensity, this is helpful when using METs as impractical. Moderate physical activity is considered a 5 to 6 out of 10 on a rating of perceived exertion, or RPE scale, while vigorous physical activity is an RPE 7 to 8 out of 10. Alternatively, moderate physical activity allows you to talk but not sing, while vigorous physical activity makes it difficult to say more than a few words without getting out of breath. It may seem unnecessary to have several different definitions, but this makes sense when considering any given physical activity may be much easier or harder based on your underlying fitness level. For people with underlying health conditions or poor baseline cardiorespiratory fitness, using the relative measurements with the RPE scale is more practical than considering the absolute MET scale. Now that you understand the 2018 guidelines, we can see what changes were made in the 2020 WHO guidelines for ages 5 years and older. It turns out that the guidelines are almost completely the same, which makes sense considering they were largely based on the same body of literature. The only major distinction is that for children and adolescents, these newer guidelines recommend averaging 60 minutes of moderate to vigorous physical activity daily, while the prior guidelines recommend reaching 60 minutes every single day. The WHO guidelines also emphasize the benefit of decreasing sedentary behavior and the health benefits of going beyond the guidelines. Now that you know what to do, you can work to meet the guidelines. I have made videos previously that discuss the basic aspects of resistance training, so you can watch those for more information. For the aerobic portion, there are many options. If you are an adult, you can run at a 15-minute mile pace for 25 minutes 3 days per week. Alternatively, you can break exercises up into 1 to 5 minute sessions and perform several of these each day. During these short sessions, you can do exercises such as jumping jacks or burpees or any other exercise you feel comfortable performing where you push yourself to 7 out of 10 on an RPE scale. If you instead wish to focus on moderate physical activity, you can take advantage of the fact that this is easy to perform in any setting by incorporating brisk walking into your daily routine. For example, you can set a timer to go off every 30 minutes at work and then get up and walk briskly around the office for 3 minutes. Resistance training itself counts as moderate physical activity, and if you push yourself hard, particularly with circuit training where you do not take breaks between exercises, this can be considered vigorous physical activity as well. All this activity adds up. Be creative and find a strategy that works for you. The health benefits of meeting the guidelines are numerous. This includes lower risks of mortality, cardiovascular disease, high blood pressure, type 2 diabetes, high cholesterol, several cancers, dementia, anxiety, and depression. Meeting the guidelines can lead to improved cognition, sleep, physical function, body composition, and quality of life. However, you do not have to meet the guidelines to obtain some health benefits. For example, a 2023 systematic review and meta-analysis found that reaching just half the recommended minimum amount of physical activity will decrease your risk of early death by 23%, your risk of developing cardiovascular disease by 19%, and your risk of developing cancer by 10%. Any physical activity is better than no activity. Other research has supported the claims in the WHO guidelines that going above the recommended levels will yield additional health benefits, though there do seem to be diminishing returns, particularly as you approach twice the upper limits of the recommended levels. There is some debate about if going very far above the guidelines will lead to negative health ramifications, but based on all the literature I have looked at, I do not see any reason at this time to limit your physical activity due to these concerns. Exercise in general is very safe to perform when you build up gradually. There are some medical conditions where you will want to limit your activity or take certain precautions, such as with certain heart conditions or if you have diabetes with peripheral neuropathy. So check with your healthcare provider prior to beginning an exercise program if you are unsure. When you do start, if you were previously sedentary, then stick to moderate physical activity for 4 to 8 weeks and build up gradually to vigorous physical activity. If you experience any worrisome symptoms, such as chest pain or an abnormal heartbeat, stop your physical activity and check with your healthcare provider before continuing. You should now have a basic understanding of the physical activity guidelines. I am showing an infographic on the screen that summarizes the guidelines and main points of this video. If you would like a copy, there is a link in the description below. Almost everyone can increase their physical activity levels enough to experience significant health benefits, and you almost certainly can as well. Find some type of activity you can perform safely and enjoyably if possible, and push yourself to improve over time. When you start to see and experience the various benefits that exercise provides, this can motivate you to push even further. Anyways, I hope you all found this video informative, and I will see you in the next one. Goodbye.